In the final video in our series covering the mechanics of your heartbeat, we're going to explain what exactly blood pressure is and how you can measure your blood pressure and the rate at which your heart is beating without any fancy hospital machinery. So first off, what exactly is blood pressure? Well, we know that the word pressure is another word for force, and that your blood is mostly made out of water. Therefore, blood pressure is a form of water pressure, meaning that blood pressure is a measurement of the amount of force that the water in your blood is exerting on the walls of your blood vessels. And we can actually measure and describe blood pressure specifically at one point in the heartbeat, which is ventricular systole, meaning the point at which your ventricles, specifically the left ventricle, contract in order to push blood out of the heart and into the arteries of your body. So what we're going to look at are the changes in the structure of the aorta, the largest artery in the body that carries blood out of the heart. Now, when the left ventricle contracts, all of the blood that is inside of the left ventricle is going to be pushed into the aorta, thereby increasing the amount of blood that is in the aorta compared to before the left ventricle contracted, and therefore this is going to cause a massive increase in the blood pressure that is felt within the aorta, because again, more blood is present in the aorta, which means there is more water, which means that water is going to exert more force on the walls of the aorta than before the contraction. Now, what we will see when we take a more detailed look at arteries versus veins is that the walls of your arteries are actually relatively flexible. The word that we use for that is elastic, as in flexible like an elastic band, meaning that your arteries actually have the ability to expand outward in order to create more volume so that more blood can travel through them whenever your heart, specifically your ventricles, contract. Now, as this blood moves farther away from the heart, the arteries where the blood used to be before it traveled farther downstream, these parts of the arteries contract, returning to their normal size, while as the blood travels, it's going to cause the arteries to expand outward in order to accommodate more volume, and this is going to travel farther and farther down the artery until the blood actually gets where it needs to go. In fact, this expansion of the arteries, where you actually feel the pressure wave created by the left ventricle causing your arteries to bulge out, you can actually feel this. This is what we call your pulse. And as long as you can find one of the major arteries in the body that are close enough to the skin to be able to feel it, you can feel this pressure wave. The two most popular locations where you can actually feel the pulse, one of which is on the artery that supplies blood to your brain, which is what we call the carotid artery, and you can find this by starting from your ear and tracing a line down right below your jaw, and if you feel a pressure wave at this location here, what you are feeling is the pulse of your carotid artery. The other popular location is right at the bottom of your hand. This one actually took me a while to find, but there's an easy way that I found to reliably find it. If you take your fingers and trace a line from the side of your thumb down to the top of your wrist here, you should be able to feel the pressure wave created by your heartbeat at an artery that we call your radial artery that supplies blood to your fingers. A third location that is also a good sign that you are undergoing some sort of anxiety from a sympathetic response, you can actually feel increased throbbing in your temples here. So if it feels like your head is pounding, it's not actually your brain that's doing that. It's actually your faster heartbeat, and the throbbing that you feel is the movement of the pressure wave through an artery called the temporal artery, which is right underneath the temples, which are the holes in the side of your skin or of your skull right behind your eyes here. Now, does this increase in blood pressure because of ventricular contraction last forever? Well, obviously not. We know that your blood is not energy. We're not transporting wind or something here. We're transporting water, and all of this water, as well as your red blood cells, are going to rub up against the blood vessel walls of all of the arteries where they move, thereby creating friction, which is going to cause blood to slow down. Now, as your blood is moving slower, meaning as blood moves farther away from the heart, because of the fact that friction of your blood rubbing up against the walls of your blood vessels is going to cause blood to move slower, this is going to cause a gradual decrease in blood pressure as we move farther away from the heart, thereby causing pulse to weaken and become less obvious. This doesn't mean that you're dying. It simply means that the increased speed and increased force with which blood moves gets weaker the farther away from the heart it goes. This is why you cannot feel your pulse if you try checking it in veins, which are the blood vessels that return blood to the heart. And there's a very simple reason why. If we follow the pathway that blood takes to supply blood to your fingers, for example, blood leaves the heart and travels through this artery here, past your radial artery, in which it enters the hand, and then this blood is going to get to capillaries, where it's going to drop off the oxygen that it needs and collect the carbon dioxide that it will have to return to the heart. Now, these blood vessels that carry blood back to the heart would be your veins, and this is why you cannot feel pulse inside of your veins, because the blood has already gone all the way from the heart around all of the major arteries in your arm through capillaries and then comes back. And by this point, the blood pressure created by the contraction of ventricles has mostly disappeared, which is why checking your pulse in a vein is never going to work. Now, checking blood pressure is a major component of any physical exam and any test to see if your heart is working properly, but because the heart actually has two major stages, atrial contraction or atrial systole and ventricular contraction, ventricular systole, there are actually two different measurements that are given. For example, most people understand that normal blood pressure, quote unquote normal blood pressure, is listed as 120 over 80. These two numbers represent two different stages of your blood pressure. So the 120 part is what we call your systolic blood pressure, and we can see the word systole here, meaning that it's talking about contraction, specifically when the ventricles contract. So because ventricles need stronger muscle than atria, this is why the systolic blood pressure is the highest point of your blood pressure, because the ventricles need a significantly large amount of force in order to pump blood out of the heart, including against gravity, and especially to get around the rest of the body. Now, the opposite, therefore, or the low measurement in blood pressure is what we call your diastolic or diastolic blood pressure, which, again, diastole means relax, meaning that this is when the ventricles are relaxing, and therefore this would be the low point of blood pressure, which is why blood pressure of 120 over 80, why both numbers are listed as the high points and low points of your blood pressure respectively. Now, let's say that your blood pressure is not 120 over 80. There are two possible conditions where your blood pressure is abnormal. One of these conditions is called hypertension. Now, we know the word hyper, or the prefix hyper rather, means more than, meaning that hypertension is another word for high blood pressure, indicated by any blood pressure that is over 140 over 90, for example. So 20 units over the systolic high and 10 units over the diastolic high is officially classified as high blood pressure. while the opposite condition, which is actually worse, is what we call hypotension. And since hypo means less than, that implies that our blood pressure is lower than the 120/80 benchmark, and both of these are of critical concern. Hypertension implies that the heart is actually overworking in order to perform its basic function, and this is a potential danger because if the heart overworks and if the muscles in your heart require rest and the heart actually stops beating, that's what we call cardiac arrest. And hypertension, especially chronic hypertension, is something that we want to avoid, while hypotension is actually even worse because that means that the heart isn't doing the amount of work that is necessary, meaning that your blood is not getting to the locations in the body where it needs to, which is critical because that means that some of the organs might be deprived of oxygen, and therefore both conditions are equally critical that you go to a medical professional and see if there's anything that you can do to get treated in order to deal with them. This concludes our series on the mechanism of the heart. Before you move on to the next series involving blood vessels and the distinction between arteries and veins, you can take a look at the two case studies below, the first of which dealing with artificial pacemakers and how they are similar to the nodes that regulate your heartbeat. And the second case study actually looks at some of the causes of chronic hypertension and looks at the reasons why your heart can actually get overworked, leading to chronic hypertension.